Hello, my friends. I'm Dr. William Carter. I've spent more than 3 decades working as an internist here in St. Louis, Missouri, most of that time caring for patients in their 50s, 60s, and 70s. And today, I want to talk with you about something that truly shapes the rest of our lives, the new blood pressure guidelines. You know, after all these years sitting across from patients, listening to their fears and their hopes, I've come to see blood pressure as more than just numbers on a machine. It's a quiet story that unfolds inside each of us, one that can either steal years from our lives or gift us with more time to love, to laugh, and to remember clearly. These new guidelines from the American Heart Association and the American College of Cardiology aren't just technical updates. They are a reminder, almost a wake-up call, that we need to take high blood pressure seriously, earlier and more personally than ever before. In the next few minutes, I'll walk with you through what's changed, why it matters, and how each of us can use these lessons to protect not only our hearts, but also our minds and our memories. You know, once we step into our 50s and 60s, we begin to see life through a different lens. Every heartbeat feels more precious because health is no longer something we can take for granted. And sadly, here in the United States, every 34 seconds, someone dies of cardiovascular disease, the leading cause of death. In Missouri alone, where I live and practice, the number reaches over 15,000 lives lost each year. These aren't just dry statistics. For me, they are faces, smiles, and patients I once sat across from, doing my best to give them more time with their families. That is why, after nearly a decade, the American Heart Association and the American College of Cardiology decided to release new blood pressure guidelines. They recognized that we can no longer treat high blood pressure as a minor issue, waiting until complications appear before taking action. Instead, the focus is on intervening earlier, stronger, and in a more personalized way. These new guidelines are not only about the numbers on a blood pressure cuff. They also speak to lifestyle, from low-salt meals, morning walks, and restorative sleep, to stress management and mental well-being. And they highlight something we now know with greater certainty, that controlling blood pressure helps prevent dementia, one of the greatest fears of aging. Put simply, the context for these new guidelines is a wake-up call. High blood pressure is not a distant concern. It lives with us in our everyday choices, and how we face it today will decide how long we stay healthy, and how clearly we remember in the years to come. What struck me most in this update is how experts want us to see blood pressure as more than just a number. In the past, doctors often said, "Keep it under 140/90 and you're fine." But now, the picture is much broader. The new guidelines emphasize that blood pressure must be understood within the whole context of cardiovascular health. That's why a tool called Prevent is now recommended. It helps both doctors and patients see a person's 10-year heart risk based on age, cholesterol, diabetes, smoking habits, and many other factors. Another important change is when to start medication. If blood pressure reaches 130/80 mmHg, patients are urged to make serious lifestyle changes, and in some cases, consider starting medication sooner. When it rises to 140/90 mmHg, instead of trying one drug at a time, doctors now recommend beginning with 2 medicines combined in one pill. This allows faster control and reduces the chance of gaps in treatment. And finally, something I believe many of us care deeply about, the evidence is stronger than ever that keeping blood pressure steady protects not only the heart, but also the brain. In older age, what we fear most is not always death, but the possibility of living without memory, without clarity of mind. And managing blood pressure today may very well be the key to safeguarding those precious memories tomorrow. My friends, after many years in medicine, I've come to realize a simple truth. High blood pressure doesn't cause immediate pain, but it quietly erodes our lives. It's like an underground stream. At first, it seems harmless, yet over time it carves deep into solid rock. The new guidelines we've just explored are a powerful reminder that, to keep our hearts strong, we must act earlier, more consistently, and more personally. Don't wait for complications to appear. Starting today, each of us can take small but meaningful steps, reducing salt at the table, walking 20 minutes a day, getting restorative sleep, and most importantly, checking blood pressure regularly. And if medication becomes necessary, see it not as an enemy, but as a companion. Those tiny pills can give us more years of clarity, more moments of laughter, more time surrounded by children and grandchildren. Remember, controlling blood pressure safeguards not only the heart, but also the mind, that priceless treasure of aging. So the message I want to leave with you is clear. By managing your blood pressure today, you are gifting yourself a longer, healthier, and more mindful tomorrow. My friends, we've just walked through some of the most important updates in the new blood pressure guidelines. But knowledge only becomes powerful when we turn it into action. Starting today, you can take charge of your health by checking your blood pressure regularly, watching your meals, moving your body, and giving yourself the gift of better sleep. These small steps are the most valuable gifts you can offer your heart and your memory. If this video gave you even a spark of encouragement, a fresh idea, or simply a reminder that change is possible, I'd be grateful if you'd take a moment to click the like button below. And don't forget to subscribe to Health Bloom Path. Here, I'll continue sitting down with you, sharing simple but meaningful health stories, the kind that can help us live longer, healthier, and with clearer minds. Together, let's make Health Bloom Path a place where every visit plants a new seed of health and peace in your life.